So today I'm going to talk to you about GAD, and GAD is glutamic acid decarboxylase. So it's an enzyme, ACE, that removes D, the carboxyl group from glutamic acid. And so glutamate is converted to GABA via GAD. And the reason we need to know a little bit about GAD, the enzyme, is we can have antibodies against GAD. So if you have anti-GAD antibody, you are blocking the conversion of glutamate to GABA. And because GABA is an inhibitory neurotransmitter, if you inhibit the inhibitor, you'll get excitatory phenomenon. And so for neuro-op, the kinds of things that we see in patients who have anti-GAD antibody are oscillopsia, and that's the sensation that things are jumping because your eyes are jumping, and that's nystagmus. The typical nystagmus that we see in GABA-related anti-GAD antibody is downbeat nystagmus, but it can be PAN, which is periodic alternating nystagmus, or it can just be gaze-evoked nystagmus. So the type of nystagmus is not that localizing, but the most common one that we see is downbeat nystagmus. It can also cause diplopia, and that diplopia can be from a number of central mechanisms, including skew deviation. And it can affect cerebellar function. And so when you have cerebellar eye signs, that's going to be saccadic abnormalities, cogwheel, saccadic pursuit, slow saccades, hypermetric saccades, any kind of saccadic abnormality. And neurologically, they might have ataxia. So they have these cerebellar ataxia people also get the GAD antibody. And it can cause convergence, spasm, and supranuclear type of ophthalmoplegia. So that's basically how the GAD comes to me. And you need to know that GAD is associated with other neurologic and systemic findings. One of them is latent autoimmune diabetes of adulthood, LADA. It kind of looks like diabetes type 2 plus diabetes type 1, so it's kind of a diabetes 1.5. So it's a older patient who's thin, so it looks like type 1, but they actually have no insulin dependent yet. So it's like a type 2, an adult, but a thin person. And in that case, LADA, you should test for the GAD. The other antibodies and their thyroid should be checked to make the diagnosis. This you should probably leave to endocrinology. So the other neurologic thing that we see is stiff person syndrome. So stiff person syndrome is also a GAD-associated phenomenon. And some of the patients have limbic encephalitis, and that means they can present with neuropsych manifestations. So I'm ordering the GAD when there's stiff person, unexplained limbic encephalitis, unexplained cerebellar ataxia. I'm going to ask about diabetes type 2 because it might be diabetes type 1.5, which is LADA, an autoimmune latent adult version of diabetes. We're going to be thinking about it when we have unexplained downbeat nystagmus, but any kind of nystagmus, including PAN or gaze-evoked, and any unexplained diplopia in association with any of the other GAD findings. You should be thinking about glutamic acid decarboxylase antibody, GAD.